traumatized by a day. Let me just grab my water and I'll be right back. Feel like I had to take my camera off. I look so bad. But some of you saw me in lab. All right, let's get started so you're not stuck here forever. I'm going to share my screen. Somehow I have to calm down. Here it is, share. Okay. And so let me write this down. So I have a lot of slides. And do you guys have something you need to be at, or I'm sure people have stuff you have to do. So for that, I am sorry too. What I wanted to do was kind of make sure that we kept clicking along. I have 108 slides. The hypertension is last, but some of those slides, the ones related to meds, are what you received in class, but I have explanations and stuff like that with them.
Are you able to record this and post it with there being so many? Because some of us have to leave.
I'm happy to post them. So I'll wait, halfway through and send them out? Or you want me to end this and here, want me to just text them now?
Yeah, if we could, then we can just wait, she's gonna post.
Let me wait a little bit, at least, and then I'll just send them out, okay? When more get in here. Okay, and first one's infection. A nurse is caring for the following group of patients with infections. Which infection is classified as a hospital-acquired infection? Let me put your polls up. And I'm doing the multiple answer, even though there's just one answer. Okay. So A, respiratory infection contracted from a visitor. B, vaginal canal infection in a postmenopausal woman. C, urinary tract infection in a patient who is sedentary. And D, wound infection caused by an unwashed hands of a caregiver. So I'm going to close these kind of quickly. So be reading them and jump in on your answers, okay? Because I've been doing much more than a minute. So let's take like 45 seconds. So watch that. Okay. So D is actually the answer. And the reason for that is a hospital-acquired infection directly results from either diagnostic or a therapeutic procedure. And when a caregiver does not wash their hands, they end up transmitting the pathogens that can cause wound infections and different types of infections. Patient's stool specimen is positive for C. diff. Which isolation precautions should the nurse institute for this patient? Droplet, contact, reverse, or airborne? I'm getting ready to close it. So get your answers in. Good.
Oh, you ready to do B?
So it's contact.
Yeah, I'm doing
Um,
this also, forget it. Just give me like,
some people are talking and have their audio on. Who have illness transmitted by direct contact or with items contaminated by the patient. So C. diff is, you sometimes you'll see it as a GI, but it is contact. And like you can't let anything against your uniform. You have to wear the gown. You have to wear gloves. Clean all the countertops well. You don't have to wear a mask, but many times people do. It just depends. So for the most part, everyone got that. Relaunch. Which should the nurse do to interpret the transmission link in the chain of infection? A, wash your hands before providing care to a patient. B, position a commode next to the patient's bed. C, provide education about a balanced diet. Or D, change a dressing when it is soiled. All right, I'm going to end the poll. People are jumping right in here. And you are correct that the answer is A. And it's that direct transmission of the microorganisms from one person to another is interrupted when the microorganisms are removed from the skin surface by hand washing. Patient's urine is cloudy, amber, and has an unpleasant odor. Which problem may this information indicate that requires a nurse to make a focused assessment? A, urinary retention. B, urinary tract infection. C, ketone bodies in the urine. Or D, high urinary calcium levels. You guys have already been studying. It's very obvious. Going to, at least infection you have been. Doing great. And wait a minute. Let me go back here. So I see why you picked urinary retention, but the patient's urine is cloudy, amber, and has an unpleasant odor. That all indicates a urinary tract infection. Which problem may this information indicate that requires nursing to make a focused assessment? So best answer, because it's sitting here, is a urinary tract infection. Could urinary retention be causing this? Yes. But there also could be other causes, is the issue. Okay. So when you have the concentrated, you've got the amber or even a darker amber, which there can be presence of bacteria. You want to check the white blood cells, red blood cells, and that unpleasant odor is pyuria, which is pus in the urine.
I don't think the new poll went up. I think the answers from A was from the previous question.
Oh, oh, really? Okay. Thank you. Because I panicked. Thank you so much. Yeah, I panicked. I don't do this now. Thank you, though. All right. Which is an effective nursing intervention to prevent urinary tract infections? Teach female patients to wipe from back to front after urinating. Advise patients to report burning on urination to a healthcare provider. Instruct patients to use bath powder to absorb perineal perspiration, or encourage patients to drink several quarts of fluid a day. What is happening to my computer? Hmm. I'm not sure just what happened. I'm going to stop sharing for a minute. No, now it's back. But my slide presentation is not. What the devil happened? Here we go. Okay. I'm going to stop. I'm going to end the poll. Can you see this still?
No.
No? Okay. Then I will go back. Let me escape from this. Okay. Let me go back in and share. Okay. And view. I think I just slid my hands somehow and it just moved everything. So the answer to this was D. Drink a minimum of 2,000 mLs of fluid a day, which produces adequate diluent for the urine and washes out solutes, flushes the microorganisms from the distal urethra and the urinary meatus. So other people were putting advise patients to report burning on urination to the healthcare provider. And burning is a symptom we can see or have at times, but unfortunately, not everyone will get that. And it's actually seen less like for someone young, frequently they will have burning, but the elderly, especially, will rarely have burning. And their first sign of a UTI is actually you see them get confused. And I'm not sure what age that starts at. It's definitely around 75 that you'll see that more commonly with people, but definitely drinking a fair amount of water, unless it is contraindicated, is extremely important. The nurse is educating the parents of a pediatric client with recurrent UTIs about perineal hygiene. The nurse's rationale for including this component is that 80% of UTIs are caused by which bacteria?
I can't see the answers at all to be able to pick an option.
You can't?
I don't see anything but a black screen.
How about anyone else?
I can see everything perfectly.
We're good.
Yeah, I see the words. The blue.
Let me
Okay.
log this out.
Yeah,
What are
I
the
don't know
options?
why who that wasn't seeing anything because I reshared and everything. So I'm
Is
going
that
to end.
person on their phone?
Is it on your phone?
No, I'm on an iPad. Let me go to my laptop.
Okay. So the answer is C. Perineal area and the urethra can easily become contaminated with E. coli from fecal materials. And basically that's responsible for 80%, like really most of the UTIs. Now, I can, depending on what you want, because I know I started late, do you want me to click through some of these and not do these and move to the next category and have a little bit of each category? Or would you prefer
There's
me
a couple of us
just-
here and we're okay with you doing the meds. Hypertension.
Are most of you interested in, is the majority interested in hypertension?
Yeah.
All right. Well, let me click onto that and then I'll backtrack. Because I will be posting the slides. My thought was that I was talking about doing that if I even started on time, just because I didn't want to, like I want to hit what's most important for everyone, but still post them. And if you wanted, I could stay on longer, but I know you have to study for the exam also, so. Stop sharing. Relaunch. So this is your session, not mine. So I'm always open to do whatever. So these are the beginning of the hypertension. And there's a little bit of other stuff. A patient is admitted to the emergency department because of hypertension and oliguria. For which additional clinical manifestations associated with this cluster of information should the nurse assess in that patient? A, thirst, B, retention, C, weight gain, or D, urinary hesitancy? I'm going to end the poll. So oliguria is the inability to produce more than 400 to 500
No, you got
units
8.
of
You
urine.
sure? It's just a discharge. All right, thank you.
What we would expect is 1,000 to 3,000. Turn off your please turn off your mic. 3,000 a day. If urine is not being produced to an intake of 2,500 mLs of fluid, then there will be retention and reflection in the weight gain. And 1 liter of fluid weighs 2.2 pounds. So excess fluid contributes to increased circulatory volume, therefore causes hypertension. Does that make sense to everyone?
I'm sorry, can you go back to the yeah, okay, weight gain.
It was weight gain. All right. So when when they have oliguria, it's the inability to produce the correct amount, like 400 to 500 mLs of urine a day. And really, we ought to be somewhere between 1,000 and 3,000 a day, right? Depending on the fluid output, you need a daily, and yeah. Does that make sense? Okay. A patient with hypertension is given discharge instructions to take the blood pressure every day. A nurse is evaluating a family member taking the patient's blood pressure as part of the patient's discharge teaching plan. Which behaviors indicate that the family member needs additional teaching? Select all that apply. So this is checking the blood pressure on a patient that has hypertension. And what are you going to make sure that you're teaching? A, position the arm higher than the level of the heart. B, place the diaphragm of the stethoscope over the brachial artery. C, apply the center of the bladder of the cuff directly over the artery. D, release the valve of the manometer so that the gauge drops 10 millimeters of mercury per heartbeat. And E, inserts earpieces of the stethoscope into the ears that they tilt backwards. So when you see this, it makes you realize that there is a lot related to teaching family members to take a blood pressure, especially if they're using like the traditional stethoscope and everything. So another way this could be worded would be that a nurse is evaluating a new nurse's technique in assessing the blood pressure as opposed to a family member. So I'm going to end the poll. Share the results. And let's see what the scoop is here. So it's A, D, and E. So the blood pressure should be taken on the arm supported at the level of the heart. D could result in a inaccurate reading. The valve on the manometer should be open to allow the gauge to drop 2 to 3 millimeters millimeters of mercury per heartbeat. The earpieces need to be in. So I always say like they're tilted forward, but like when you're holding your stethoscope in your hands, they're tilted away from you, like kind of in direction of your nose, the way your nose goes. Because if they face backwards, they're going to be blocking, the holes will be blocked by your ear canal. Make sense? Do a relaunch. So you have a 66-year-old male client has his blood pressure checked at a healthcare fair, and it is 168/98. which action should the nurse implement first? A, recommend that the client have his blood pressure checked in 1 month. And B, instruct the client to see his healthcare provider as soon as possible. C, discuss the importance of eating low salt, low fat, low cholesterol diet. Or D, explain that this blood pressure is within the normal range. So the reason I have these in here is this is stuff that will also be tested on. And everyone gets very nervous about the meds and hyper focuses on the meds. And then you can actually get the med questions correct, but get everything else wrong that you needed to be focusing on too. Going to end the poll. And the question was B, that they really do need to see a healthcare provider, that this diastolic pressure should actually be less than 85 millimeters of mercury. The nurse is teaching the client recently diagnosed with essential hypertension, which instructions should the nurse provide when discussing heart healthy exercise? A, walk at least 30 minutes a day on a flat surface. B, perform lightweight lifting 3 times a week. C, recommend high intensity aerobics daily. Or D, encourage the client to swim laps once a week. Okay, going to end the poll. Okay, walking 30 to 45 minutes a day. The answer is A, will help to reduce blood pressure, weight, and stress, and will increase the feeling of well-being. What your notes say is to engage in exercise 150 minutes of moderate intensity aerobic activity a week, or 75 minutes of vigorous aerobic activity a week. And you want to aim for 30 minutes most days of the week. And that would be 5 to 6 days a week. So people did well on that. Share. Let's bring up the next one. So there were 2 people that put B, which is fine. You may not get everything correct. Okay, the nurse is teaching the dietary approaches to stop hypertension. So the DASH diet. The DASH diet to a client diagnosed with essential hypertension. Which statement indicates that the client understands the teaching concerned with the DASH diet? A, I should eat at least 4 to 5 servings of vegetables a day. B, I should eat meat that has a lot of white streaks in it. C, I should drink no more than 2 glasses of whole milk a day. Or D, I should decrease my grain intake to more than twice a week. So this, I think, is tricky because you really have to have a visual in your head of what's appropriate for the DASH diet. And some of these look obviously wrong, but then others could be under that stressful situation, you could get mixed up. I'm going to end the poll. So A is the correct answer. You know, it's a diet high in vegetables and fruit. The male client diagnosed with essential hypertension has been prescribed an alpha adrenergic blocker. Which intervention should the nurse discuss with the client? A, eat at least one banana a day to help increase potassium level. B, explain that impotence is an expected side effect of the medication. C, take the medication on an empty stomach to increase absorption. Or D, change position slowly when going from a lying to sitting position. This is an alpha adrenergic blocker. Now, just so people know, when I'm done this, I'm going to go back and do other slides. Okay? I know someone had said that they want to, see all the slides, go over them. So I don't want that person like,
And are you gonna upload the whole
I
thing
am.
again?
Oh, I am, yes. But I'm happy to go over them and do polls anyway. But I will upload the whole thing. When we get close to what would have been the time we would have been breaking up. Okay, let's go to the answer.
Where do you upload them? Because I've never been able to find them after the.
Oh, I don't upload them. What I do is I put them in the chat.
Oh,
Did you not know that?
no. You said you upload, so I'm looking for an upload.
Oh, I'm sorry. No. In the past, I've always put them in the chat. Did you realize that?
No, not me.
Okay. Yeah, when I go through it at the end, I just put it in the chat. So the correct answer was D. Orthostatic hypotension may occur when the blood pressure is decreasing and may lead to dizziness and lightheadedness. So the client needs to be changing positions very, very slowly.
I have a question.
Yeah.
So, can you go back?
Yeah. Go ahead.
So I chose B because I read male client, so I'm thinking it's like impotence is gonna be directed towards the male, right? But because I know that hypotension is also a like side effect or adverse effect.
Right.
So is him being a male not important then?
I think what I would do here, I think it's not the most important piece. The most important piece is you have an alpha adrenergic blocker. Okay.
Yeah, but
And
I understand that because I know both of them are adverse effects for the alpha blockers. So I just thought that
the male was the most
male
important
was,
thing.
yeah, because I mean, you can say just a regular client, So I was thinking male client. I don't know.
Right.
I guess I'm just kind of.
So yeah, I'm looking at the PowerPoint right now
Okay.
slide, and it's an adverse effect. It doesn't say anything about orthostatic
ahead.
hypotension. It has about impotence, but it doesn't have anything about orthostatic hypotension.
Really?
Yep.
What are the drugs on there?
The what?
The names of the meds.
It just has doxazocin.
Oxazocin.
Yeah,
I
it
mean,
has
honestly, they're both adverse effects. So I feel like this would be better as a select all that apply then. Now, the one where someone could get
Yeah,
hurt
and
would be the need to change position slowly. But
So can I just assume that it's D because that's the priority intervention?
yes, that's
Okay.
where this person could get hurt.
Okay.
And then, yeah, so that would be the priority, but if it were, like, I don't want to knock that one out, period. So I think that's where this was coming from, as being the priority assessment. And it did not say that, to be fair. Okay. If this were an exam question, written exactly as it is, okay? Because impotence, oh, wait a minute. I would not say that it's an expected side effect. There's the key word. Because then the male is gonna ask them, why are you putting me on this? I don't want to take it.
What are we assuming is not an expected side effect?
No, it is a possible side effect.
Which one? The impotence or the?
Yes, impotence.
What doesn't say anything about?
I think that's what you're saying.
Go ahead. There's still a question, right? I don't understand why this slide, it definitely, if you look in the notes and stuff, it would be, you could have orthostatic hypotension. Because that really is a side effect of every single antihypertensive med. The issue with this is that explain that impotence is an expected side effect of the medication would be like, why are you giving that to me then? There have to be other meds I can take. And it's not expected. It's possible, to where you want the men to know it is possible, so they come and they discuss it. But it's not expected. Does that make sense now? Yes or no?
Yeah, that makes sense.
Okay. Because I was getting ready to say that I would have to like give it back because they're both side effects, but expected is the key word that makes you say no. And that's what I need to do, is add it to the answers, so I don't have to dig so hard to get it in my head. Okay, furosemide. Identify the patient assessments that the nurse will monitor when furosemide is prescribed. So before you go to give this med, nope, not even just before, in general, what are you going to be monitoring? Many times before, but you're also going to continue to monitor stuff. So you have A, apical pulse, B, blood pressure, C, hemoglobin and hematocrit, D, intake and output, E, sodium, potassium, and magnesium, and F, weights. I'm getting ready to end the poll. Bite the bullet and just put answers in. It's okay if you're wrong. At least you committed to something. Okay. Okay, the answers were B, D, E, and F. So I'm going to do blood pressure, intake and output, sodium and potassium and magnesium levels, and daily weights. So furosemide can cause a decrease in the blood pressure. Okay. So you want to check that before and after administering it. The sodium, potassium, and magnesium levels can drop. So you want to be looking at them, especially that potassium, before you give it, and continue to monitor them. And intake and output and daily weights should also be monitored. P, D, E, and F. So B, D, E, and F. So there's no need to monitor apical pulse, and there's no need to monitor hemoglobin and hematocrit for furosemide. A clinical scenario: a nurse is caring for a patient admitted with hypertension who has been prescribed valsartan, furosemide, and terazosin. The client's current blood pressure is 162/86 with the heart rate of 64. Serum potassium level is 3.2. Which of the following is the best action by the nurse? So what I would do with this is confusing, isn't it? Don't look at the answers. So how to answer this is think of valsartan. Okay, what is the classification of valsartan? And what do you have to check before you give valsartan? Okay, now write that down. Furosemide, what classification? What do you need to monitor before you give furosemide? Terazosin, what classification? What do you need to monitor? Now, go find your answer. Like now, look at the blood pressure, look at the heart rate. Is the blood pressure too low to give any of these? Obviously not, correct? Look at the heart rate. What is the cutoff heart rate for giving a med that will decrease heart rate?
60.
Pardon me? 50 or 60?
Is it 60?
60, yes. Potassium level is 3.2. What is a normal potassium level?
3.5?
Yep, 2.5. So potassium level is low, right? So now look at all the meds and decide what can you give and what can't you give. Then go find your answer. So BP is elevated, administer all medications to assist in lowering the blood pressure is A. B, administer valsartan and furosemide, hold the terazosin and notify the prescriber. C, hold all the medications and notify the prescriber. D, administer terazosin and valsartan, hold furosemide and notify the prescriber. I'm going to end the poll. So what we're looking for here, our 3.2 is abnormal, right? So we don't want to give anything that'll drop that potassium further, correct? So which med will do that? Furosemide, right? Wherever it says to give furosemide, we can knock that one right out, can't we? So the answer was D. And this is basically what I went through with you. These. So terazosin, an alpha-1 blocker, will decrease blood pressure. Valsartan's an ARB. It'll decrease blood pressure as a side effect of hyperkalemia. So it will help to, it can help to elevate it. But in this case, it's 3.2. So you do not want to give that. It's way too low. Okay? Does that make sense to everyone? In my opinion, these are very much how to attack a question. They're hard. Here's another one that can make you very confused. So identify the blood pressures that fall in the elevated blood pressure category. Classification. So when you sit down to take this exam, a brain dump is helpful where you just write stuff down on your piece of paper. And one of the things I would write down before you get to one of these questions would be the classifications of the drugs, of the blood pressures. So A is 118/70, B is 120/72, C is 130/82, D is 146/88, E is 128/68, F is 124/76, and G is 122/58, and H is 129/78. So this is actually more options than you would have, but that's okay. So now you see how this says elevated blood pressure? I would rewrite this question to say class 1 hypertension or class 2 hypertension or a normal range, and take this with all of those. I'm going to end the poll, share the results, and here are the answers. So A is normal, B, E, F, G, and H are all elevated. C is stage 1, D is stage 2. But do you see how that question could just make your head spin during an exam? Or maybe I'm wrong.
I have a
don't-
question. Why is 120 part? Isn't like 120 the baseline or
Needs
is
to be
that-
below 120.
Oh, okay.
That's tricky. That's why it's in there. It needs to be less than 120. Good question, though. Excellent question. Better to ask it here than in test review. Next question. So here are ACE inhibitors. An angiotensin converting enzyme or ACE inhibitor, you want to know both those names for a patient with hypertension. I guess it's prescribed. Which statement is most appropriate, the most appropriate rationale for administering this medication? A, ACE inhibitors prevent beta receptor stimulation in the heart. B, this medication blocks the alpha receptors in the vascular smooth muscle. C, this medication prevents vasoconstriction and sodium and water retention. Or D, ACE inhibitors decrease blood pressure by relaxing the vascular smooth muscle. So this is basically how the drug works. Now, I think you guys went over these in class. Did you? I'm going to end the poll because I left these for my replacement instructor. I don't know, I could have tweaked some of them, but they're hard questions. And some of these are definitely harder than you would see on an exam. Oh. Do I really not have an answer key for this? I don't. I thought I put them all in. So who wants to have a rationale as to why the answer?
It's D. Because ACE inhibitors prevent angiotensin 1 from converting to angiotensin 2. So it doesn't have any, it does prevent vasoconstriction, but C would be incorrect because it promotes sodium and water excretion and retention of potassium. So D would, it like promotes vasodilation of the blood vessel, of the smooth muscles of the blood vessel. So that vascular smooth muscle, it's promoting dilation of that muscle.
Very good. Go ahead.
Wait, never mind, go ahead.
He said D. Was that your question, or were you thinking he said B?
Relaxing vascular smooth muscle, are those not alpha receptors?
Someone pull up the notes.
Because when you prevent angiotensin 1 to 2, you're preventing vasoconstriction.
Alpha blockers control cardiovascular muscle in the heart. So, or it deals with, it blocks a alpha receptor in the cardiovascular system. So like in the heart, vascular smooth muscle is like,
ACE inhibitors.
yeah.
Okay.
Okay.
Someone have their notes open? Hmm? The problem with it does prevent vasoconstriction, but the sodium and water retention is a concern there, you know?
My fault. She was actually right because the alpha blockers do.
Yeah, that's what I'm saying. Like,
She's right about the
the
vascular
alpha,
smooth muscle.
yeah, so it wouldn't be ACE inhibitors, it would be the actual alpha receptors,
Alpha.
right?
Mhm.
It would,
I'm
D,
agreeing with you. I'm saying you're right.
oh yeah, so D would actually, it's wrong because it would be alpha receptors, not ACE inhibitors.
Correct.
Yeah.
No, but it does.
Which,
The ACE inhibitors do promote excretion of sodium and water, not
Yeah.
retention.
Yeah,
Is that what you're saying?
yeah, I understand. Okay, so what's the answer? Yeah.
I think it's still D though, but like because that C is incorrect because it doesn't. Oh, it prevents. Oh, my fault. It prevents sodium and water retention. So yeah, no, I think it's C then. Yes, you're right.
yes, I'm sorry.
It'd be the
I
word.
started
The
getting
wording
into
is
the
what it
same
is.
thing. It prevents sodium and water retention.
Yeah.
It prevents it. So it's the wording. This medication prevents vasoconstriction, but it also prevents sodium and water retention. So it's
So
preventing
what is
all
the
that.
right choice?
Pardon me?
What is the right answer?
C. C.
Let's see, right?
Yes, it's C. No
Okay.
question. And what I was doing when I kept reading it was I kept looking at sodium and water retention, thinking it's retaining, it's retaining, it's retaining, and it's not. It's definitely C. Sorry about that.
Okay, the wording is a little confusing.
Yeah.
So the answer, which is C, says this medication prevents vasoconstriction. And the second line says, and sodium and water retention. So that means it also prevents sodium and water retention,
Yes,
correct? Well,
yes,
the way they worded it just made it so confusing. Okay,
it does.
got it.
I'm gonna change the wording. Because the wording was confusing me, which is really bad. And I'm wondering if that's what you have on your worksheet from what I wrote initially, like your class worksheet, you know what I mean?
Yeah.
But I made a note to change to do prevents vasoconstriction and prevents, I think is better. It just makes it more clear, especially for an exam.
We get updated version of this upload.
A what version?
So we're missing the answers for that question, and there's also a typo. It looks like. Will we get a updated version of it, like with the corrections, when you upload it?
Tell you what, let me just do it now.
Okay.
Let me escape. And let's just do it now. Because I think that just makes it more clear. There, then it's very clear. There. Whoops. And that's how I would prefer it for an exam. Just, it's more clear. You good now? I just don't, I hate taking up time to do that, but I think it's necessary if, because I don't
Much
like
better.
that. It was not clear enough, and then it's going to mess with you. You'll have to remember it later. All right, hypertension. A nurse is preparing to administer medications for a patient admitted with essential hypertension who has a history of hypercholesterolemia and atrial fib. Assessment data includes an apical pulse of 68, blood pressure of 118/64, and potassium of 4.5. Which of the prescribed medications will the nurse administer? A, valsartan, B, hydrochlorothiazide, C, digoxin, D, diltalazem, and E, atorvastatin.
Can you put up the poll, please?
Oh, yes. Let me escape. That's what's happening. Because once I there, let me end the poll here. So I don't think, do any of these, none of these have the answer key, and I thought I went and put them back in. Shoot. I dropped these in last semester, is what happened. Okay, so I turned off that. So all of these are prescribed. And which can you give? So apical pulse is 68. That means you can give the digoxin, correct? Potassium is 4.5. That means that you can give the hydrochlorothiazide, correct? Patients in and out of atrial fib, the digoxin will help with that. And they do have hypertension. So the valsartan and the diltalazem can be given. All right. Even though the blood pressure is 118/64, that is what is maintaining that blood pressure at a wonderful blood pressure, actually. Okay. The atorvastatin is for the hypercholesterolemia. And I believe, if I remember right, diltalazem can help out a little bit with the AFib. Not positive. What's your thoughts on that? And this is an example where we really had to find a reason not to give one of these meds. So all of these are ordered for my patient. Here are my vital signs. My heart rate's above 60. The number I used to tell patient or students for holding a blood pressure medicine was 110. Now, that's what it would be on the ACE unit where I used to work, which was adult care for the elderly. On a regular floor, someone my age or 40 or 50, they would usually use the cutoff as a systolic of 100. Okay. So I would be comfortable giving the valsartan and the diltalazem, knowing that they'll drop the blood pressure. The hydrochlorothiazide will also drop it some, but these are all safe to give. And it is not uncommon to have someone on technically 3 blood pressure meds. More people in the world are on 3 blood pressure meds than you would be surprised. Does that make sense to everyone? Or does that feel like too much med? Okay, metoprolol. The nurse is administering metoprolol to a patient diagnosed with essential hypertension. Which intervention should the nurse implement? Notify the healthcare provider if the potassium level is less than 3.8. Question administration of the medication if the blood pressure is 94/56. Do not administer the medication if the patient's heart rate is greater than 100. Monitor the blood pressure while lying, sitting, and standing.
Go back to the last one for a second. So all of them, the last question was all of them we could give?
Yes, all of them. So I would just make a note that you can give all of them, just so you remember. And I believe that question is in the questions that they went over in class. I'm going to end the poll for this one. I'm sorry these aren't in here. whoops, I meant to. So the answer for this is B, 94. So you would not want to give this if the patient's blood pressure is 94/56. That's very low. Okay. And it's just going to go lower. So you would want to call the doctor, and you don't just hold it and not do anything else. You usually are going to hold it. Like if you don't have parameters, you hold it and call and tell someone. If you have parameters, you hold it and just document the blood pressure, and you don't need to call anyone. So the answer to this is B. Nurse is caring for a client with a history of hypertension who is treated with metoprolol, hydrochlorothiazide, and captopril. The client's current blood pressure is 120/80 with a heart rate of 48. Which of the following is the best action by the nurse? So again, here, what we want to do is look at metoprolol. What is the class of that med? Beta blocker. What does it do? Does it lower blood pressure and heart rate, or just blood pressure? So answer that question in your head to make your decision. Hydrochlorothiazide, that's the diuretic, right? So that one lowers blood pressure, but we would want to, it'd be nice to know what the potassium is, right? It's not as strong of a diuretic as Lasix, though. And then captopril is what? Pril?
ACE inhibitor.
Exactly. So the blood pressure is 120/80. So we can give all three meds based on the 120/80, can't we? Does captopril lower heart rate or just blood pressure? Anyone know? Only blood pressure. Okay. Just blood pressure. Hydrochlorothiazide does not affect heart rate either. So the 48 heart rate knocks out your metoprolol. Okay. Can't give metoprolol. So let's go find our answer. Administer metoprolol and hydrochlorothiazide and hold the captopril. Notify the physician. That's not the right answer, is it? Administer captopril and hydrochlorothiazide, hold the metoprolol, and notify the physician. So in my mind, that's very clearly the answer. Would you agree? But never stop here. Always read the other answers, even though you come to the correct answer. C is withhold all medications and notify the physician. We don't need to do that because there's no question we can give the captopril. Administer all medications and notify the physician. No, we don't want to give all the meds because the metoprolol, that needs to be held with a heart rate less than 60. And we're at 48. It's way too low. So the correct answer is back to B, administer captopril, the ACE inhibitor, and hydrochlorothiazide, the thiazide diuretic, hold the metoprolol, which is your beta blocker that will decrease heart rate, and notify the physician. So the answer is B. Everyone good? This one I did have one. And I said the answer was B, and there's the rationale for that one at least. Okay. Which medication am I? Which medication causes water and sodium excretion from the kidneys but does not deplete potassium? So furosemide is A. B is angiotensin 2 receptors. So they're the ARBs, right? C is spironolactone. D is hydrochlorothiazide. E are the angiotensin converting enzymes or the ACE inhibitors. So what do you want to think about here? All right, furosemide, does it deplete potassium? Yes, correct. The ARBs, do they deplete potassium? No. They actually have a side effect where they can retain some potassium. Like you can go too high if you're giving. Like you would never want to give a spironolactone and an ACE inhibitor together for the most part. Hydrochlorothiazide deletes potassium, and so does the ACE inhibitor, can cause hyperkalemia as well. So the answer to this is C. And I have the answer for this one. So it's the potassium sparing diuretic, causes loss of potassium bicarbonate and calcium, while sodium bicarbonate, while saving the potassium and the hydrogen ions by antagonizing aldosterone. So the main thing here, remember, it's a potassium sparing diuretic, so it gets rid of the other but doesn't, not the potassium. Okay, the renin-angiotensin aldosterone system. Identify the drug classifications that target the renin-angiotensin aldosterone system. Select all that apply. So A are alpha adrenergic blockers, B are ACE inhibitors, C are ARBs, D are beta blockers, and C are calcium channel blockers. So we're looking at which drug classifications target the renin angiotensin aldosterone system. I'm going to end the poll. So I don't have a thing for this. So the first ones that come to mind for me that are most obvious are your ACE inhibitors and your ARBs, okay? B and C. But if you look at your notes, what you should see is that beta blockers also do that. There's a chart that I used to use in my notes, and it showed that all three of these did. So the answer is B, C, and D. It is not an alpha adrenergic blocker, and it's not a calcium channel blocker. Okay? So make a note that ACE inhibitors, ARBs, and beta blockers are drugs that affect the renin-angiotensin-aldosterone system. Questions on that?
I just wanted to ask, how does the beta blocker, like, in what sense? Is it because it causes, is like, which beta blocker is it? Is it the
All the beta
cardiac?
blockers,
Oh, okay.
metoprolol, all of them.
Okay.
Does that answer your question though?
Yes.
Okay, it's all the beta blockers. Anything that ends in OLOL. Did you have a chart in your, or did they delete it? In your meds lecture?
Yeah, it's like a graph of everything, and like they'll put like blood vessel, like I think under blood vessel it's diuretic, or
Right. Okay,
no, blood volume it's diuretic because it
blood
changes
volume.
like the fluid, and yeah, the sodium.
And then there's something related. There's one that says the angiotensin, all of that.
Right.
And the two big giveaways are the ARB and the ACE inhibitor,
Right.
because it's like right in the, anytime you ever look it up. But beta blockers actually do too.
Okay. Thank you.
Right. You're welcome. I am so sorry I don't have the, last semester I put these slides in and I had just had my hip replaced. And I went and was clicking through my slides and thought that they all had answers. So I was like, oh, I must have fixed that last semester. I was like on pain meds when I dropped all my slides in. And I wasn't on pain meds anymore when I went and checked them. I just did it too quick. So here we have the nurse caring for a diabetic client with chronic renal failure. Classifies as hypertension as, so a diabetic client with chronic renal failure classifies the hypertension as what? I'm going to end the poll because most have already done it. And it is secondary is why they have it. Okay, B. Whoops. Okay. Nurses teaching a family with several members at risk for hypertension about measures that can be taken to help prevent hypertension. The nurse includes which of the following? Select all that apply. So what are the different things that the patient can do? Diet rich in fruits and vegetables, increase sodium, reduce cholesterol, stop smoking, engage in isometrics. I think you guys are nailing this. Yeah, but no answer, seriously. So you want to A, eat a diet rich in fruits and vegetables. You do not want to increase the sodium in your diet. That's the last thing you want to do. That is not an answer. C, reduce cholesterol. Definitely stop smoking. The problem with isometrics, wait a minute. Is you really want to have aerobic exercise as opposed to isometric exercise. Okay? So aerobic is what you're encouraging as opposed to isometrics. So the answer is A, C, D. And I'm not looking good today with all these not showing. I'm really sorry. Hyperkalemia is a side effect of which medications? Diltalazam, A. Captopril, B. C is valsartan. D is metoprolol. E is doxazocin. And F is spironolactone. So you want to think of which classifications. So it's not about the med, it's about the classification. So which classifications come with a side effect of hyperkalemia? Does anyone know the classifications that come with it? Anyone have the nerve to tell me?
Diuretics and I think ACE inhibitors and ARBs, right?
ACE inhibitors, ARBs. Now, most diuretics cause hypo, don't they?
Yeah, but the last
There's
one,
one diuretic that causes hyper, isn't there?
yeah, it's the potassium sparing, I think.
Yes. Which is which drug here?
F.
Yeah. So the answer would be not diltalazem, that's a calcium channel blocker. Captopril, pril, ACE inhibitor. Valsartan, sartan, ARB. Metoprolol, that's a beta, right? Zocin, that's an alpha. Spironolactone. So it's B, C, and F. But what I really want you to know are the names of the classifications and what they end in. That's what you need. You can't memorize every single med on that sheet. What you need to memorize are the classification and the ending, how it works, and what the side effects are. So again, in case I don't have an answer key, which I'm ready to crawl into a hole, B, the prils. C, sartans. F, spironolactone, which is your potassium sparing. They can all cause hyperkalemia. And I have it this time. Okay. Everyone see that? Let's get rid of this. And pretty soon I'm just going to send you out the slides, but I can keep on going through the other categories as long as you want me to. Okay, hydralazine causes select all that apply. Does hydralazine constrict blood vessels or no? Does it cause vasodilation? Does it cause hyperkalemia? Does it cause bradycardia? Does it cause a decrease in blood pressure, hypokalemia, decreased cholesterol levels? So when would you give hydralazine? A patient's having what problem? Anyone else want to answer in the poll? The answers are B and E. What you're going to give hydralazine for is hypertension. So it does not cause constriction. That would cause you more hypertension, correct? So what you want is vasodilation. and that's what it causes. It does not affect potassium at all. Fortunately, it doesn't cause bradycardia, which makes it a nice, you'll see hydralazine a lot as a PRN med for, like, you may already have 2 antihypertensive drugs. You know, one could be valsartan and one could be hydrochlorothiazide. But the patient's blood pressure is still elevated, and because those 2 drugs aren't getting it down and the patient's not having pain, okay, where you need to give a pain med, then you need to give something stat or now, like when the patient's blood pressure, despite their meds. So it's nice that it doesn't cause bradycardia. It just causes vasodilation, which causes a decrease in blood pressure. So you can frequently see this as a PRN med. Does that make sense, everyone? Okay,
Yeah.
that must be the last one of this unit. Good, high blood pressure. All right, so what I'm going to do is I'm going to go out of this. Okay, I am going to make a PDF of this. Download. Here, let me find it. Module 3. Okay, let me. I'm going to go back. The people that want more, do you want me to finish these infection or just go to thermoreg?
Thermoregulation.
Okay. So let me get rid of this. Pull up the chat and drop it there. So unfortunately, I see people left. I'll be on longer and I can always drop it in again. And maybe this time I need to just post it and even people that didn't come get it.
Okay, I'm not sure where you dropped it, but I can't find it. Where should I go?
Go to the chat.
I am there. I just see thermoregulation.
You don't see module 3, elimination, and you have to get it in the chat, not just my slide where I'm sharing. Can you go down to the bottom and see the chat? See where I'm pointing? Does anyone else see it in the chat?
In chat. She just needs to click on the chat button on the bottom so it opens up and then she could click down on it from there.
See
Yeah,
where
I
I'm
can see it too.
circling? Who said they didn't see it? Because I need to hear
Me,
from
can you move your mouse again? Let me see what I'm supposed to be looking at.
down here. It's on the very bottom, mine is.
Mm-mm. I am in the chat. I see nothing. Okay, now I do. I do.
You see it?
Now I do. Yes.
All right, make sure you can open it and download it.
Okay, hang on. Oh,
Because I
yes,
definitely want you to have it.
I got it. Thank you.
All right. Oh, you're very welcome. All right. So let's go back to this then. Now I'll stay here as long as you want me to. I mean, and don't feel bad if you're saying I need to get off and just study. I'm just going to look at it myself. I understand that. Okay, a nurse concludes that a patient's elevated temperature, pulse, and respirations are significant. Which step of the nursing process is being used when the nurse comes to this conclusion? Okay, we have
I don't
seven
see a
of you.
poll.
You don't see the poll? Does everyone not see the poll? One person answered.
Okay.
Someone else sees it.
I'll just put my answer in the chat.
I only have 2 people out of 6. I'm going to end the poll. And it's D, analysis. Okay. And then I have everything under analysis here for you. You can read on your own. A nurse is caring for a patient with a fever, which is a well-designed goal for this patient. Do you want me to read the answers or do you just want to read them yourself?
No, I can read it.
Is anyone on a phone that can't see them? Okay, I'll just let you read them then. That's why I read the answers, is because people are on their phones. I have 3 out of 6. 4. Okay, I'm going to end the poll. So the answer is C. And the goal, it's the one that says the patient will maintain fluid intake adequate to prevent dehydration through the day. It needs to be centered, specific, measurable, realistic. The words adequate and dehydration are based on generally accepted criteria against which to measure the patient's actual outcome. And the word maintain connotates continuously. which is a time frame. A nurse admitting a patient to the emergency room on a cold winter night would suspect hypothermia when the patient demonstrates what of those four? I'm going to end the poll soon. So the answer is D. It's that slow capillary refill. Okay, and then you can read the rest of it. What is a priority nursing intervention for a patient with hyperthermia? So we're looking for hyperthermia, nursing intervention. That would be the priority. I'm going to end the poll. The answer is actually D. Seizure precautions. A seizure could happen because of the high temperature, but they're not the first intervention. The first intervention would be to get rid of that excess clothing so you can try and cool them down. Now, hyper means high, where if it was hypothermia, blanketing like clothing should be removed. That's true, but thinking that it's assumed that the blanket is gone, but I can see why people would put, you're not really going to remove every stitch of clothing for the most part, but any excess clothing you would remove. Oh, the answer, that's what I thought. The answer, it said provide a blanket, and you would not provide a blanket. That would be for hypothermia. So the blanketing and everything would be removed, just like clothing would be. You wouldn't add a blanket. Patient with hypothermia is brought to the emergency department. What will the nurse explain to the family member that treatment will need to include? So we have hypothermia. I'm going to end the poll. The answer is A. With core rewarming, with heated oxygen, it administer warmed oral or intravenous fluids, would be the preferred method of treatment. The patient really would be too weak to be able to ambulate if they're that hypothermic. What clinical indicator will the nurse most likely identify when assessing a patient with pyrexia, dyspnea, precordial pain, increased pulse, or an elevated blood pressure? So you have to know what pyrexia is for this, don't you? So this is just rare vocabulary. If you don't know what pyrexia is, you really can't answer the question. So where we don't go in and say which of the following are is the correct definition of pyrexia, we do kind of put it in a question like this. I'm going to end the poll. Oh, someone jumped in. Good. So the fever may be increased, but does not cause difficulty in breathing. Pain is not going to be related to the fever. The pulse rate will increase to meet the increased tissue demands for oxygen in a febrile state. And then blood pressure is not necessarily elevated in a fever, but the pulse rate is. A homeless person is brought to the emergency department after prolonged exposure to cold weather. The nurse would assess the patient for manifestations of hypothermia, including which of the things that below. Select all that apply. So rapid respiration, stupor, erythema, pallor, increased anxiety, decreased respiratory rate, drowsiness, decreased blood pressure. So sometimes with these, I would want to, now these are more answers than you would get. You only get A through E. But I would almost want to think about what are the things I may assess for someone with hypothermia? Like, what are the signs and symptoms of that? And then look for them. They would be my definite answers. And then the other ones, maybe things I just didn't think of. And again, you need to know what stupor, erythema, and pallor all are. And if you don't, now's the time to go back and find out. It's not a big deal. I'm going to end the poll. This is a hard one, I think. I think all these select all that apply are very hard for students. They're very intimidating. That's why I kind of put a lot in here. So the answers are actually B, D, F, G, and H. So stupor, pallor, drowsiness, decreased respirations, and decreased blood pressure. So that begs the questions, which one we're not. So A, C. So A, C, and E were not answers. So we can go back. So decreased respiratory rate as opposed to increase. E, erythemia, or C, erythemia was not an answer. And also increased anxiety. Because if they're having this many symptoms, they're probably not going to have a lot of anxiety. They're going to be too sick. Nurse is caring for an unconscious client who is experiencing persistent hyperthermia with no signs of infection. The nurse interprets that the hyperthermia may be related to damage to the client's thermoregulatory center in which structure. So all of these words basically are saying, where is the thermoregulatory structure? I'm going to end the poll. The answer is D. Wait a minute. Not right here. The answer is D, hypothalamus. Okay. I'm just going to correct that now. Well, I have to get rid of this again because of the, let me end this totally. And now I can reshare. No, I'm already sharing. Now I can do this. It doesn't like it when I take the chat off. Okay. Or the slideshow off. It doesn't let me put polls back on. Stop sharing. Client's baseline vital signs are as follows. Temperature's 98.8, it's Fahrenheit. Orally, pulse 74, respiration's 18, blood pressure 124/76. The client's temperature suddenly spikes to 103 Fahrenheit. Which corresponding respiratory rate should the nurse anticipate in this client as part of the body's response to the change in status? I'm going to end the poll. And the answer is D, that the respiratory rate would increase. And that one had the highest respiratory rate. Client complains of being cold, and the nurse notes the presence of goose flesh on the client's arms. The nurse plans care knowing that which structure is responsible for this response. I'm going to end the poll. I'm going to put more answers in or no. And the answer was C. Guys were correct. So elimination. Stop sharing. And give
Hey,
you a
I'm
new
just gonna
poll.
let y'all know that I have to go, so I'll just view the rest with the slideshow you sent.
Okay, thank you for staying, and I'm sorry that I was late and messed everybody up.
That's okay.
A nurse identifies that the patient has overflow incontinence. Which factor contributes to this clinical manifestation? I'm going to end the poll. Anyone else want to put in? Do you like me using the poll when it's as small of a group or no? So the answer is C, the enlarged prostate can cause overflow incontinence. The others would be, one would be stress, B would actually have been reflex incontinence, and then urge incontinence. So you want to make sure you know the definition of all of them. Do you want me to continue with the poll, the two that are answering? A nurse must measure the intake and output of a patient who has a urinary retention catheter. Which equipment is most appropriate to use to measure the output from the urinary retention catheter? So which piece of equipment is most accurate, basically, or the best one to use that would make most sense? Urinal graduate, large syringe, or collection bag? Okay, I'm going to end the poll because it looks like only 2 of you are doing it. And you were right. It's the graduate. And this explains why all the others are not really appropriate. So here we have a patient's urine is cloudy amber and has an unpleasant odor. Which problem may this information indicate requires a nurse to make a focused assessment? This is interesting. We had this question. And I was not in this. It was under infection. Interesting. And we both got it right. And it was the UTI again. Nurses caring for a debilitated female patient with nocturia. Which nursing intervention is a priority when planning to meet the patient's needs? So you want to know what nocturia is here. I'm going to end it. So this one, the answer is actually the commode. And the reason being is that 5 o'clock, I mean, that's a good one, but 5 o'clock is really kind of too soon before bed. You would want to like really decrease the fluids about 2 hours, the last 2 hours before bedtime. But I can definitely see why you would use that answer. Nurses caring for a group of patients with a variety of urinary problems. Which patient's physical response should cause the most concern? So this is, you need to know the definition of them all, and then know what you want to say. I'm going to end the poll. That's nice. I'm glad we had 3 this time. And it's the anuria, because that's the inability to produce any urine, as opposed to dysuria, which is the UTI. Nurse is performing a physical assessment on a newly admitted patient. Which problem identified by the nurse is often associated with urinary incontinence? I'm going to end the poll. This one's rough. It's C. It's that disturbed self-esteem, but a reduced fluid intake is unrelated to urinary incontinence. Let me think.